Welcome to this overview of the Emergency Medical Task Force, an exciting concept that is changing the way Texas responders approach large-scale emergency events. The governing entity of this subject is the Department of State Health Services, the same entity that oversees your medic certifications as well as many other professions. In the early 90s, after the passage of this Healthcare Rescue Act, and in an effort to help rural areas gain access to more health resources, Texas divided into 22 trauma service areas, then identified them alphabetically from the letters A to V. Regional advisory councils composed of about a dozen local healthcare professionals were then established within each TSA. This union of neighboring counties allowed resources to be combined, providing better capabilities to the citizens. In 2010, DSHS created another level of consolidation, combining numerous RACs, thus creating 8 Emergency Medical Task Force regions in Texas. The EMTF is part of a much larger statewide public health and medical response system known as the Texas Disaster Medical System, which coordinates numerous agencies from the acute care side and the public health care aspect. Once again, the goal is the same: combine the numerous RACs resources to provide a more coordinated, efficient, and effective response in times of emergencies. Each EMTF's goal is to structure and organize 4 components within each region: ambulance strike teams, RN strike teams, ambuses, and a mobile medical unit. The ambulance strike teams consist of teams of 25 ambulances with an ambulance strike team leader, ready for deployment to provide emergency medical capabilities and evacuation assistance in times of emergencies. RN strike teams consist of 25 registered nurses, also ready for deployment in times of emergency. These teams will help support overwhelmed hospitals, alternate care sites, or other duties as assigned. The ambus component, also known as multi-patient vehicles, are custom-built, extremely versatile buses specifically designed for the simultaneous transport and treatment of 20 bed-confined or critical patients in times of emergencies. In 2011, they were used in a Bastrop wildfire event as a rehabilitation center for firefighters. The most complex component is the mobile medical unit. The mobile medical unit is a mobile medical aid and stabilization center that can be established on virtually any level ground and become a self-sustained medical unit for numerous days. Upon request, strategically placed trailers and trucks hauling power stations, shelters, medical equipment, water purification systems, and much more will deploy from numerous areas within the state to a predetermined location. In about 6 hours, the MMU can begin accepting patients. Keeping in line with the span of control concept described in the NIM structure, 2 levels provide direction to the components in action: the EMTF coordinator and the EMTF task force leader. The coordinator provides support and management for all aspects of the EMTF program, serving as the primary contact for local offices of emergency management, local emergency response agencies, hospital, local health departments, regional DSHF staff, councils of government, or any other agency to provide guidance during planning, coordination, implementation, and response. The task force leader provides direct oversight of the components in the affected area, sustaining visibility and information flow bidirectionally. While maintaining within the NIM structure, the task force leader will direct the focus of the 4 EMTF components to remain within the strategies developed by command. With these 4 components working cooperatively within a predefined structure, you can expect an effective and efficient coordinated response to large-scale emergencies. You can follow these links for more information.